What is the first thing that comes to your mind when you hear the term spine surgery? The first thing that comes to our mind is long incisions, long period of bed rest. But nowadays, same outcome can be achieved without a big incision. When we say navigation, it is just like how you use your maps in your car or on your phone. Robots are used during spine surgeries to put in your screws. What is the first thing that comes to your mind when you hear the term spine surgery? The first thing that comes to our mind is long incisions, long period of bed rest, post-operative back pain, prolonged recovery periods, when you will be able to go back to work. So these concerns are all understandable, and these were actually true a couple of decades back when somebody underwent a spine surgery. My name is Umesh Srikantha, and in this video, I'm going to tell you about what are the benefits or what are the advances that have happened in the last couple of decades in the terms of spine surgery, which are going to help you to recover from a surgery faster and get back to your work faster. Now, when we talk about improvements or advances in spine surgery, we always talk about two things. One is the improvements in the technique of spine surgery per se, a technique in the sense how the surgeries are performed, how big the incisions are, what are the instruments that are used for performing this surgery. And the second thing is what are the technological advances, means what are the other instruments like navigation, like intraoperative imaging, robotic assistance. What are those things, the technology that has been used in terms to make the spine surgery safer and effective. Olden days spine surgery used to involve long incisions. They used to be called as open or conventional spine surgeries, where you put a big incision in the midline, open the muscles in order to get access to the spine in order to do the surgery that is required. But nowadays, same outcome can be achieved without a big incision. They can be achieved with very small incisions, either via what we call as a keyhole surgery, where the surgery is done to small 1.5 to 2.5 centimeter tubes, a cylindrical tube which will go into your spine, and the surgery will be done through them. Or it can be done with the help of an endoscope, where the endoscopic channel is even smaller, where it ranges from somewhere around 8 millimeters to 12 millimeters. And the entire surgery is performed through these small endoscopic channels. The amount of damage that is caused to the muscles of your back or the other structures that are there around your spine is very, very minimal. And that helps you to recover faster. The blood loss that happens during surgery is smaller, and the post-operative pain that you have is also significantly less. Fortunately so, there have been significant improvements in the technology as well. How? We can monitor the nerves during surgery so that even without our knowledge, there is no damage that happens to the nerve, which is called as intra-operative neuromonitoring. And these help us to pick up if the normal nerves are getting damaged or getting affected by our surgical procedure. And it will also help us to take corrective measures. If there is any abnormal drop in the signal, it will help us to take a corrective measure to rectify that during the surgery rather than identifying it after the surgical procedure is completed. There have been improvements in imaging during the surgery. And nowadays we have something called as an intraoperative 3D imaging. It could be intraoperative O-arm, intraoperative 3D C-arm, or an intraoperative CT, which will help us to take a 3D image of the spine during your surgery, and it will help us to actually identify the structures as you are seeing in the scan, not just on an X-ray, as you are seeing in the CT scan or as you are seeing in a good 3D scan. Now, these 3D images are also combined with navigation. When we say navigation, it is just like how you use your maps in your car or on your phone. So these things can help you to identify structures before you reach there. Before you actually go, it can tell you that, okay, this critical structure or a nerve or a bone is there 1 centimeter ahead or 2 centimeters ahead. It is going to tell you the exact path, the exact direction, and the exact distance that is required to reach to that particular target area. And that helps in placing our implants. You know that spine surgery also involves putting in screws. And often we have heard in olden times that the screws have gone outside the spinal canal, the screws have touched the nerve. but these things are very, very rare. These 3D imaging techniques and navigation can give more than 99.5% accuracy while placing screws in the spine. Robots are used during spine surgeries to put in your screws. Then that improves the accuracy further even in complex cases. Both the advances in technique, that is endoscopic and minimally invasive spine surgery, as well as the advances in technology, that is neuromonitoring, intraoperative 3D imaging, navigation, robotic spine surgery. So both put together have made spine surgeries very safe and very effective.